available. Your slides are visible.
Okay, yeah. So let me start with this picture. This is a picture of CGMS Gold, the first ever CGM that was introduced in India way back in 2005. So it was FDA approved in 1999, and it came to India in 2005. So this is our hospital manager, Ms. Jayasree, holding the first CGMS Gold. And this slide shows the evolution of CGM in India, the journey of CGM sensors in India. We started with the CGMS Gold in 2005, and until 2014, we just had the iPro 2 as the only standalone CGM device. And in 2015 came the revolution, the Freestyle Libre Pro, and in 2018 we witnessed the launch of the first real-time CGM from Medtronic, that is the Guardian Connect, and in 2020 the Freestyle Libre was launched. So this is the broad evolution of CGM in India. And let us now look at the different types of CGM devices. We have the blinded or the professional CGM, as all of you are aware. This one would measure the glucose levels, but it will not be displayed in real time to the patient. So this is basically a retrospective CGM. The patient will have to visit the doctor, and the doctor would be deploying the CGM, and then using a reader, it will be activated. And the patient will have to return back to the clinic maybe after 10 to 14 days. And the patient and the healthcare provider should sit together to assess the glycemic patterns. So this is about the professional CGM or the retrospective CGM. And we also have the real-time CGM, where, as the name mentions, the values would be displayed in real time, and you also get the alarms and alerts at specific glucose intervals. And another category is the ISCGM or the intermittently scanned CGM, where the glucose levels would be measured continuously, but it will be displayed only if you swipe the reader over the sensor. And another classification is the integrated CGM. As the name suggests, it can be integrated with your AID, that is the automated insulin delivery systems, your insulin pumps, your connected blood glucose meters, and all of those newer platforms which are there for your diabetes management. And we have one more category which I have not included, which is the implantable CGM, where the CGM is implanted just under the skin, and it will give you on-body vibes and alerts. So these are the available CGM devices now in India. We have the Guardian Connect, which is a real-time CGM. We have the Libre Pro, which is a retrospective or a blinded CGM. And we also have Libre, which is the intermittently scanned CGM. So the new addition to the Medtronic family, we have the Guardian Connect since 2018. And the new addition to that is the Guardian 4 Smart CGM system. And so these are the components. They have the Guardian 4 sensor, the transmitter, the CareLink personal software, and also the Guardian app. And the uniqueness of this system is that it doesn't require any finger stick calibrations. You don't have to calibrate. So there is no calibration circle on the home screen if you look at the app. And you also have the customizable alert volumes, and it has got improved battery life and have better user interfaces. The screen is black, so there is enhanced visibility. And let me now discuss an interesting case with you, which is that of a 62-year-old professor. He's a very busy man, lot of travels, taking classes for students, and he has got a diabetes duration of 12 years when he visited our center in maybe 6 months back, and his A1C was 10.2% with a BMI of 32, and he had a history of CAD 5 years back. He was on injection, the premixed human insulin, twice daily, and he was also on a basal analog, that is a glargine, along with metformin and glimepiride and a generic SGLT2 inhibitor. So we changed his prescription and we put him on oral semaglutide, 3, 7, and 14 milligrams, graded up-titrated, and then we also put him on the DAYDEIC, the co-formulation, along with an SGLT2 inhibitor and a statin and ARB. And we put him on a regular telemedicine follow-up, and he was affordable enough to go for the Freestyle Libre. So as you are aware, CGM is now recommended by all of the scientific organizations to be done in the clinic. And so this is the Libre data at baseline. As you can see here, the blood sugars are all over the place. The time in range is just 19%, and there's an open time above range of 81%. And after 6 months, along with diet, exercise, medications, and a continuing motivation using the Libre, he could achieve an A1C of 7.2%, and just see his TIR. His TIR, the time in range is 84%, and there is no time below range as recommended for his CAD history, with significant improvement in the eGFR. So there are a lot of evidences that is being generated with the Freestyle Libre system, and the replay study, which is a randomized control trial, has demonstrated that it significantly reduced the time spent in hypoglycemia when compared to patients who were using SMVG. and on intensive insulin therapy. And there are a lot of real-world evidences that are coming up. The FLAIR study is one among them, and there is yet another study from Miller Richard, and all of these studies have shown that the use of Freestyle Libre decreases hospitalizations and all-cause hospitalizations in basal and non-insulin patients. And the FLAIR study also demonstrated the use of Libre system resulted in decreased hospital admissions, work absenteeism, increased quality of life, as well as improvement in the glycemic control. And this is some of the publications from our center on the therapeutic utility of professional CGM. We use iPro2 for this study, and we analyzed the PCGM, and we could demonstrate that PCGM can provide actionable data and motivate patients for diabetes self-care practices. This is yet another study using the Freestyle Libre Pro on age-25 type 2 diabetes patients, where we shared our experiences regarding the clinical utility and user-friendliness of Freestyle Libre Pro. Let me also briefly tell you about other CGM devices which are available globally, but unfortunately not available in the Indian market. We have the Eversense E3 CGM, which is an example of an implantable CGM. It is a 180-day implantable sensor, which is inserted just under the skin. And it is the only CGM that provides you with on-body vibrating alerts for high and low sugars. As you are aware, the sensor requires 2 calibrations for the first 21 days of wear, and after 21 days, you just require only 1 fingerstick calibration, which is required each day. And this is an FDA-approved device. It was FDA-approved in 2022, but not yet available in the Indian market. The latest addition to the Freestyle family is the Libre 3. We have the Libre 2, and Libre 3, and the latest addition is the Libre 3, which is a real-time CGM, and it is also cleared as an integrated CGM. It can be used along with other AIDs, and you don't need to scan the sensor every 8 hours. It will provide you, without scanning it, you will get the values in real time, and it is 70% smaller than the previous model. And the latest addition to the Dexcom family is the G7. We have G6 as of now, and now it is a G7, which is 60% smaller when compared to the G6, and it is a thinnest generation of its CGM sensors. If you remember, the G6 have the sensor and the transmitter attached to it, but this one, the Dexcom G7, there is the transmitter and the sensor on the G7 is actually combined, and you also have the fortune of having multiple wear locations. You can use it on the abdomen, on the upper arm, and it can be used up to a wear time of 14 days. And you don't require fingerstick calibrations. It is approved for non-adjuvant use. Let me also tell you about some of the non-invasive continuous glucose monitoring devices that are in the pipeline. We have the Scanbo, which is a non-invasive finger measurement to measure the glucose, and we also have the G5 from Hager Technology, which got the FDA Fast Track designation last year. So it can be worn like a bracelet comfortably on the wrist, and it uses the radio frequencies to detect the glucose levels. And we also have the GraphWear, the Movano smartwatch, My Sugar Watch, and D-Sensor, which are also undergoing clinical trials. Lively from LifePlus is another one. Afon Watch, NovioSense are some of the examples of non-invasive CGMs which are currently undergoing clinical trials. And you have Sugarbait, which is from the UK-based Nemura Medical. It is already approved for use in Europe. As you can see here, there is a small peel and place patch, and over it is a rectangular transmitter which sends wireless readings to a smartphone app via Bluetooth every 5 minutes. And you have U-Band and KnowU from Know Labs, which are also examples of non-invasive CGMs. So any discussion about CGM is incomplete without the mention of TAR. As you are aware, A1C is the key indicator for long-term diabetes complications. However, it fails to reflect the acute glycemic excursions of hypo and hyperglycemia. And it also fails to identify the magnitude and the frequency of the glucose excursions. In addition to this, conditions such as anemia, hemoglobinopathy, iron deficiency, and pregnancy can also confound the A1C measurements. So to streamline this data interpretation and to provide more actionable information than just A1C, we have a metric called the time in range. So what is time in range? So time in range was primarily introduced for effective and safe glucose control. And there are 3 key parameters, 3 key measurements, which is time within range, time above range, and time below range. So why do we require TAR? So every 10% lower TAR can increase your retinopathy risk by 64%, nephropathy risk by 40%, and neuropathy risk by 25%. And it also shows that a lower TAR can increase the surrogate markers of macrovascular complications like the carotid edema media thickness. So let us now look at the recommendations by the consensus group, that is ATTD, ADA, and TASD consensus group. And let us look at the TAR targets. So the target range for a patient that is type 1, type 2 or non-pregnant adult, the TIR target is more than 70% and the range is 70 to 180 milligrams per deciliter. And there is level 1 and 2 hyperglycemia and level 1 and 2 hypoglycemia. So now let's look at the target ranges for the level 1 hypoglycemia. So level 1 hypoglycemia is any value less than 70 milligram per deciliter, and the patient should not be spending more than 4% of the time below range. And level 2 hypoglycemia is any value less than 54 milligram per deciliter, and the TBR should be less than 1%. Now let us look at the time above range. So TAR, any value more than 180 is termed level 1 hyperglycemia, and a TAR should be less than 25% for your type 1, type 2 and your non-pregnant adults. And level 2 hyperglycemia is any value more than 250 milligram per deciliter, and it should not exceed 5%. So these are the broad targets which are recommended for the type 1, type 2 and your non-pregnant adults. We also have specific targets for the older adults and those having high risk of complications. So here the time in target, the target range is the same. It is 70 to 180 milligram per deciliter. However, the target range, the time in range target is more than 50 milligram when compared to other people where the time in target is more than 70%. And the time below range should be less than 1% and time above range should be less than 10%. And what are the TIR targets during pregnancy? For type 1 diabetes, for those type 1 diabetes individuals who are pregnant, more than 70% of time per day is the target range, and the target range is 63 to 140 milligram per deciliter, as we have strict recommendations for the pregnant women. And for gestational diabetes mellitus or type 2 diabetes in pregnancy, the time and targets have not been defined due to paucity of evidence, and the target range still remains to be 63 to 140 milligram per deciliter. And this is the report, the AGP report as proposed by the different organizations and the consensus group, where you should be having the percentage of time in ranges at different levels. The time in range, the level 1, level 2, hyper and hypoglycemia. And you also need to have your ambulatory glucose profile, which is a summary of the glucose values over a period of time. And you should also be having the daily glucose profiles in your AGP report. And as you are aware, the different international organizations endorse the use of TIR in addition to HbA1c. The American Diabetes Association, the ACE, the EASD, and the ASPAD recommends the use of TIR in addition to HbA1c, as you can see here. Our own RSSDI also have come up with recommendations on the use of CGM. So AGP report along with the percentage TIR, TBR and TAR and the daily glucose pattern must be used for education and motivation of your patients having diabetes. And in well-controlled type 2 diabetes, they also recommend the use of fractional CGM once in 6 months, irrespective of what treatment they are taking. And the CGM may be considered in women with GDM or pregnant women with type 2 diabetes as a supplemental tool to SMPG, and especially in those of your patients who are having hypoglycemia unawareness and recurrent hypoglycemic episodes. And this is one publication from our center on the importance of TIR as a target in type 2 diabetes. As you can see here, it was initiated from our center along with Dr. Banshi Sabu and his team, and the KOLs across the country, including Anup Mishra sir, Banshi sir, and whole of the RSSDA team have come up with recommendations for South Asia on the recommended frequency of using CGM and the time in range targets. And as you can see here, any patient who is having a TR of more than 90% should be repeating the CGM once in 6 months. And if the TIR is more than 70%, they should be repeating it once in 3 months. And if the TIR is more than 50%, they should be repeating it once in 2 months. So these are the recommendations for South Asia. And I also have some good news for you. So we are soon awaiting the launch of digital tools from Abbott. So they are scheduled to launch in another 1 month in India. So we don't require the reader anymore. We can see the app, and we can have the app on in your mobile phone, in your smartphone, and you can see the values without the help of a reader. So this was another interesting publication which I came across where Freestyle Libre was used in cats and dogs with diabetes. So if cats can do it, then why not humans? So just think about this. Are we not denying justice to our eligible fellow human beings if we are not discussing the options to live longer? So thank you very much for your patience here.